Hi, everyone. My name is Allyson Drake, and I'm the founder and executive director here at Full Circle Grief Center. I'm really excited to be kicking off our virtual Conversations About Grief series. Each week, we will add at least one educational program for you all called Conversations About Grief on a variety of different topics. Tonight, I'm going to start us off with one for frontline workers. It's called Grief, Trauma, and Other Mental Health Risks for Those Who are on the Front Line of COVID-19. This is part one of this program, and tonight we're going to talk a little bit about risk factors and some of the stressors that those working on the front line in this COVID-19 pandemic are facing. Next week, we'll be posting another program called part two that'll talk about ways for these frontline workers to best manage the stress and ways that they can process their grief. So please be sure to look forward to part two. So I'm going to go ahead and share my slides with you, and we'll get started this evening. So again, it's called Grief, Trauma, and Mental Health Risks for Those on the Front Line of COVID-19, Part 1. And I'll be doing this presentation as if I'm speaking to all of you frontline workers. And when I'm talking about frontline workers for this purposes of this presentation, I'm really focused on those that are in the healthcare field or the first responder field that are taking care of COVID-19 patients on a day-to-day basis. So we're talking about nurses, doctors, respiratory therapists, all of those individuals that are working with COVID-19 patients in the ICU or in the hospital, as well as those nurses and medical professionals that are supporting and taking care of those in nursing home facilities, as well as rehab facilities. And we're also including firefighters and police officers that are also involved day to day in taking care of COVID-19 patients through transportation and 911 calls and things like that. So I want to start us off with a quote. The expectation that we can be immersed in suffering and loss daily and not be touched by it is as unrealistic as expecting to walk through water without getting wet. So I want to start us off talking about the potential feelings of frontline professionals during COVID-19. Obviously, none of us have in our lifetime faced a pandemic such as COVID-19. And there's a lot of feelings that can be experienced by those that are taking care of these patients on a day-to-day basis. And the first one that you'll see that I highlighted in all uppercase letters is grief. Like the quote said before, there's no way that we are able to work in a place of suffering and dying and death in many of these cases and not be touched by grief. And I'll go into a little bit more detail as this presentation progresses about the grief that frontline workers may face. Also feelings of anxiety, guilt, maybe I should have done more, maybe could I have been able to do more, fear many times in the very small amount of research that is available to date about the effects on frontline workers. Oftentimes the trauma and the fear and the increased stress are emphasized, that fear of getting the disease or the virus yourself and taking it home to family members, as well as witnessing the suffering, the trauma of witnessing the suffering and the dying, and then also that fear of experiencing that yourself if you were to test positive for COVID-19. Increased risk of PTSD, and that's really for any healthcare worker that on a day-to-day basis is dealing with death and dying, and being able to be present with your patients and experiencing many times in this case with the restrictions around COVID-19, being a lot of times one of the only healthcare workers that is in the room with that individual because of the regulations around family members being there. You are serving as a family member in many, many cases. And that can bring about things like a heightened risk of psychological distress and being overwhelmed, feeling overwhelmed, especially when we see these hospitals across the country that have hundreds and hundreds of COVID patients, feeling overwhelmed, constantly feeling on, constantly feeling like you're moving from patient to patient to patient without a rest. And then obviously the increased stress and fear that is around many of these facilities not feeling like they have enough protective equipment. And that fear and that stress can obviously create emotional exhaustion and physical exhaustion. And then a little bit about the isolation. You know, when you are working and taking care of these patients, many times your family members, your friends, things like that, they do not obviously understand what you've been through. And only someone that's working on that front line with you can really understand that. And that's a pretty isolating experience. And then constant awareness, hypervigilance. If you are being extremely stressed at work and feeling like that you're providing a large amount of care to your patients, you know, being hypervigilant and not being able to rest is definitely a feeling that they may have. In terms of a mental health risk, this was in a study that was very recently published in the Medical News Today, studying some of the frontline workers that were in Europe and Asia taking care of COVID-19 patients. Again, it was a pretty small study, but it's really a part of a little bit of the data that we have to the impacts on healthcare workers. But they're 52% more likely to have symptoms of depression when they're dealing with COVID-19 patients, and the death and the dying that often accompanies those that they're caring for. 57% are more likely to have symptoms of anxiety, and 60% are more likely to experience distress, and almost 3 times as likely to have insomnia than those who are not on the front line. So, and some of the stuff that I've been reading that have been that are talking about challenges of frontline workers, asking if they have a right to grieve. Do they have a right to grieve somebody that they cared for as a patient, that they provided medical treatment to? And the answer certainly is yes, it is grief. And it is a loss of somebody that you were caring for, and people that are on the front line can definitely feel extreme symptoms of grief. So I wanted to just talk about what's called normal grief, grief that people feel when they experience the death of a loved one, somebody close to them. But then often in this case can definitely be when you're experiencing a death and dying on such a wide scale of suffering. You can read through some of these, but one of the big ones is highlighting again the sleeping issues, the difficulty concentrating, and some of the withdrawal and shock and despair that comes along with grief. Wanted to just look briefly at the manifestations of grief. I think we're all too aware of, the emotional impact that grief has on us, but I wanted to definitely bring about the understanding that grief can show up in so many different ways, whether it's physical, cognitive, emotional, or behavioral. And anyone that's walked the journey of grief can definitely, I'm sure, understand or identify numerous of these symptoms or effects of grief. So again, just highlighting some of the grief that COVID-19 frontline workers may experience. The patients are dying alone due to isolation requirements, and the medical professionals are stepping in and serving as, quote unquote, family members for these dying patients. They're often spending weeks caring for these patients day in and day out, especially the nurses and the individuals who are at the rehab facilities and the extended care facilities, the nursing homes, things like that. They're spending weeks, if not longer, caring for these patients day in and day out. And as a medical professional, you are having to calm the fears, anxieties, and work through the emotions with these patients and these families, often serving as a conduit from the doctors to the patient and being there for the families. And so it's easy for us to forget that these individuals are human, but they are, and they're experiencing a tremendous amount of grief. So just, briefly, I could do a very long presentation on all of these, but I wanted to talk about death and dying and suffering and effects on practitioners. And the reason I want to talk about it is this awareness. It's not to worry people, it's not to scare people when they're in these jobs, but it's awareness of understanding what is possible if you aren't practicing healthy coping, positive coping skills, and positive self-care. So some of the keywords that I'll talk about are vicarious trauma, compassion fatigue, experiential avoidance, and professional burnout. And as you'll see, they're pretty, many of them overlap, but I wanted to make sure that I was properly defining those to you all. Vicarious trauma for practitioners, and again, vicarious trauma can occur in a variety of different ways, but today we're talking about the COVID-19 pandemic. So in terms of vicarious trauma, it's watching a patient suffer, watching a family member struggle with not being able to be there, and experiencing the dying and the death of their loved one. And again, watching the suffering, watching often a decline of a COVID-19 patient, and viewing that trauma, you can then therefore experience feelings of trauma yourself, and it's called vicarious trauma. So watching, observing, being part of someone else's trauma can affect you in the same way that trauma affects somebody that was directly impacted by it or directly experienced it. So these are some of the signs of vicarious trauma for practitioners. You know, and the one that I want to highlight is just that unexplained anger, feeling really irritable, feeling on edge. It can affect your personal relationships and then cause you to have an extreme amount of apathy and detachment and emotional numbing from your experiences and your everyday life. So experiential avoidance, it's really your attempt as a medical professional, as a support person, as a police officer, a firefighter, to avoid thoughts, feelings, memories, physical sensations, and other internal experiences to take yourself away from the pain. So seeing things that are horrible to witness, being involved in a situation of somebody else's death or sudden death or dying, you can try really hard to avoid those thoughts and feelings and distract yourself in other ways, take yourself away from the pain, become numb to sadness, pain, and loss. But what that can do is if you're not dealing with those feelings, it can cause problems physically, emotionally, and mentally. And again, just to state, I'm going over very briefly these different stressors or risk factors for frontline workers, but you know, if you are interested, there's a number of books, articles, you know, information that you can research for yourself if you're interested. Compassion fatigue, which is also known as secondary traumatic stress. It's called the cost of caring, and that's how it was introduced really in 1982 by Figley. It's a state experienced by those helping with people or animals. It's an extreme state of tension and preoccupation with the suffering of those being helped to the degree that it can create a secondary traumatic stress for the helper. So really compassion fatigue, when you are identifying that, it's truly characterized by deep physical and emotional exhaustion. And it impairs your ability to feel empathy for your patients, for your loved ones, for your coworkers. And the biggest challenge of compassion fatigue is that it truly attacks the very core of what brought us into our work, our empathy and our compassion for others. So here are some signs and symptoms for you of compassion fatigue. And again, the number one is really that physical and mental exhaustion that you feel, and the inability to feel sympathy and empathy towards your patients. You'll often see it as cynicism at work. And then it can transform, obviously, into a lot of mental health stressors, such as depression and traumatic stress and stress-related illnesses. So professional burnout, I'm sure many of you are familiar with this term, but it's that loss of enthusiasm for work. It can result in lack of patient-centeredness. You're there, you're punching the clock, you're checking the boxes, however you want to phrase it, but you have lost your enthusiasm for work. You feel cynicism, you're exhausted, and you feel like you're really not making that much of a difference every day, that low sense of personal accomplishment. And it is associated with early retirement, alcohol use, and suicidal ideation. So different protective factors for practitioners. And again, in part 2 of this series about frontline workers, I'm going to talk a lot about protective factors and how you reduce your risk for these, as well as some practical ideas for self-care. But protective factors, what are your life circumstances? What does your support system look like? Do you have positive coping skills that are already in place? Can you self-regulate? Are you self-aware? I'm starting to feel this way and I need to step back and do something to make sure that I don't, reach burnout or lack of empathy. And again, having that strong social support within your friends, your family, as well as your colleagues. How, are you working in an environment that is supportive, that you do have people you can talk with? Do you have people that you can process with? Or are you working in an environment of cynicism and burnout around you? And I think that having that strong social support is obviously really important. Developing remembrances and rituals. We have a huge list on our website under our bereavement resource manual of different remembrances and rituals. And those are things that you can incorporate into your life and into your practice, as a frontline worker. And, a lot of times people think these are saved for friends and family members that you were close to, but that's not true at all. It's having that ritual, that remembrance to honor those that have suffered, honor those that have died, that have been under your care or in your hospital or whatever it may be. And it can be as simple as lighting a candle before you leave work to just take that breath and honor and give space for those patients that you served that day. Or it can be a song you listen to, it can be a poem that you read, it can be a prayer, but giving space and honoring your experience and honoring those people that have crossed your path, your professional path that you've cared for, especially during this COVID-19 pandemic, giving some sort of ritual and some sort of space to honor that. And then another protective factor is for those of you that have that strong spiritual foundation, and it does not have to be organized religion. It can be a meditation practice, a mindfulness practice, just something that allows you the ability to process spiritually what you've been through and what you've experienced and seen. So again, I wish that we were live so that I could allow time for questions. But if you do have questions, if you're interested in learning any more about these topics and want some resources or some guidance, feel free to email me. Again, I'm Allyson England Drake, and my email at Full Circle is Allyson, ALLYSON, at fullcirclegc, as in Grief Center.org. And stay tuned. Sometime next week, we will publish part 2, which are practical ideas for frontline workers to feel support for their feelings of grief and trauma during COVID-19. Again, thank you for taking the time tonight to be with me, and please do not hesitate to reach out if you have any questions. And I'll look forward to seeing you all again sometime next week for part 2.